The Leeds Care Record is about trying to provide better information and tools to the patients and professionals at the front line of their care in Leeds.
All we're doing is making the information available in a different format. It's always existed on paper, and previously when we've transferred that information around, it's been done via quite insecure methods.
Sped up our processes of getting information from the hospital. It stopped us looking around for patients that might have been admitted.
We can see what medications they've been on, we can see if they've got any allergies, we can get all up-to-date information that's held by the hospital.
Sometimes you have to wait days for this information, or if you telephone for it, then there's nobody answering the phone. This information is going to be instant, and it will be quite a dramatic improvement on the system that exists at the moment.
Communication is a major focus of anything. How can a doctor make an informed decision without information?
It's fantastic for the patients as well because they get up-to-date information from our GP. So for instance, we had a patient that was admitted 999. GP was able to follow the patient to see where they went, what actually part of the hospital they were admitted to. When the patient came back to us into care again, we were able to take down letters from the hospital. Normally this could take 7 to 10 days, but this was more or less instant.
Makes life much easier for us, and also it makes things much easier for the patient because they access the treatment they need much quicker.
I can log onto a computer and look to see what consultations patients have undergone in their GP practices. I can look at their medications, and it's really going to sort of improve the experience for patients. They're not going to have to keep repeating themselves.
I saw someone in clinic last week who had seen the cardiologist, so I had a look on the Leeds Care Record, found the clinic letter from the cardiologist who'd suggested 2 drug changes. I was able to issue the prescriptions, change them things, communicate that with the GP, and it was done.
We're begun by joining up the records between the hospitals and the GP practices, but as we deliver integrated health and care in the community, the social care workers will need access to this care record to be able to deliver care to the patients.
This is the most useful thing in the last 10 years in the NHS.
It's a much more efficient system. It's going to save you a lot of time that can be spent on the patients.
The less time we spend messing around looking for information, the more care we can give.